Hi, Dr. Amy here. Today, we're going to talk about sensory challenges. So this is really common. When we look at the brain and how the brain moves through development, we understand that we become more sophisticated as we move through development, right? We have more sophisticated tools. Now, let's take an individual who's not there yet in brain development, doesn't matter the age, and let's say that one of their primary tools is tactile or movement touch. And let's put a shirt with a really irritating tag on, or shoes that are just a little bit too tight, or sweatpants is what they like to wear, and you put jeans on them that are giving them a different sensory input to the brain. How do you think that that individual is going to process that if their primary way to process their world is tactile, touch, movement? Then we change their movement environment, their tactile environment, by putting something like that's irritating or itchy or rubs them differently and they're not used to. You said it, I'm sure you did in your head. That's going to create stress, right? Because if your primary way of processing is through the tactile system, movement touch, well, that's one of your sharper tools, and then you constantly stimulate that with clothes or different input, you change that environment and you stimulate it, it's going to shut that person down that day. Now, myself, and probably a lot of you watching, you're operating from a whole brain perspective. Your primary tool is not movement touch. And so you could put on some shoes that are a little bit irritating, or some socks where the socks are on just a little bit crooked. And you could continue to go through your day and be productive, and you just block that input out, right? At first it might feel a little funny, and then you get going and you get thinking about other things and using your brain in different ways and processing in different ways, more efficient ways, and you don't even attend to that sensory input anymore, that movement touch input, that tactile input, because it's not your primary, most efficient tool to process your world. So you can just carry on through the day unless it starts hurting you or the input becomes way too great, right? Then you're going to attend to that, and then it might shut you down, or it might create you need to change that. Well, think about that in terms of a child or an adult who's not there yet, and one of their most efficient ways to process is, in fact, in that system. And then we irritate that system. We overload that system. We change that system. They are unable to efficiently avoid that because that's the primary tool they use to process their world. So we don't just want to cope with that. We don't want to just say, and often it is, we've got one pair of sweatpants that we can wear, one shirt that we can wear, very specific controlled sensory environment. We need to understand there's a reason that is happening. That is a window into the brain. It tells us a lot about where a child or an adult is putting their processing, and we need to help them become more efficient in their processing. We do that by using the clinical skills to create efficiency and get the brain in a place ready to grow and operate more efficiently. Your Focus Academy doctors are doing that, and in the educational piece, we do that by looking specifically at where the gaps may be, what are the clues as to how this individual is processing their world, and what specific games, exercises can we do to specifically strengthen and go back and fill the gaps and build that brain to a more efficient processing. So remember, there's a reason, it's not a coincidence that these sensory challenges or sensory processing challenges pop up with some of these other behavioral learning or socialization challenges, or vice versa. There is always a reason for behavior, and these things tend to come together because they are windows into the brain and how we're processing. Remember, always a reason for behavior. We're here to help you and your participant have a better expression of life.